In the ever-evolving landscape of healthcare, there is an urgent need to rethink our approach to treating chronic diseases. This necessity arises from the recognition that the conventional methods of medicine 2.0, while groundbreaking in their time, have not fully met the challenges posed by long-term, non-communicable diseases such as cancer, heart disease, and diabetes. These conditions develop over decades, often silently, and by the time they manifest as acute problems, the window for effective intervention has often narrowed significantly. Medicine 3.0 represents a transformative shift in how we approach healthcare, focusing on prevention over treatment, personalized care over a one-size-fits-all approach, and understanding risk as a factor to be managed rather than avoided. The roots of frustration with traditional medical training lie in its rigid adherence to outdated methods and a deep-seated resistance to change. This resistance can stifle innovation and keep the healthcare system from evolving to meet new challenges. A case in point involves the administration of gentamicin, a powerful antibiotic with a narrow therapeutic window. In one instance, delaying treatment until the next shift could have placed a patient's life in jeopardy. The rigid adherence to established protocols, despite real-time data indicating the need for immediate action, underscores the limitations of Medicine 2.0 and the need for a more dynamic, responsive approach, one that Medicine 3.0 seeks to establish. To understand where Medicine 3.0 fits into the historical context, it's essential to briefly look back at its predecessors. Medicine 1.0, which dominated for centuries, was based on direct observation and a great deal of guesswork. The ancient practice was characterized by a mix of helpful and harmful treatments, grounded more in tradition and superstition than in scientific understanding. The transition to Medicine 2.0, which began in the mid-19th century with the advent of the germ theory of disease, marked a significant shift. This era saw the rise of scientific methods, the development of antibiotics, and a more systematic approach to treating illnesses, particularly infectious diseases. Medicine 2.0 was transformative, eradicating or controlling many deadly diseases and laying the foundation for modern medical practices. However, despite its successes, Medicine 2.0 has struggled with chronic diseases, conditions that build slowly over time and are not easily addressed by the acute care model that Medicine 2.0 perfected. Chronic diseases like heart disease, diabetes, and cancer often have long, slow prologues, and by the time they are detected, significant damage may have already occurred. This is where Medicine 3.0 comes into play, offering a new approach that focuses not just on treating these diseases once they emerge, but on preventing them from developing in the first place. At the heart of Medicine 3.0 is a deeper understanding of risk, an understanding that goes beyond the simplistic notion of avoiding risk at all costs. In Medicine 2.0, the primary directive has often been first, do no harm, a phrase attributed to the ancient physician Hippocrates. While this principle has merit, it can also be misleading. The focus on avoiding immediate harm can sometimes lead to inaction, which in itself can be harmful. For example, in emergency trauma situations, immediate action, despite its risks, can prevent far worse outcomes. The story of a young patient with a stab wound illustrates this point well. Faced with the decision to perform a risky procedure on the spot or wait for a safer but delayed intervention, the right choice was to act immediately, saving the patient's life. Medicine 3.0 recognizes that risk is not something to be avoided at all costs, but something to be understood, analyzed, and managed. This approach acknowledges that every medical decision involves some degree of risk, whether it's the risk of a surgical procedure, the risk of medication side effects, or the risk of doing nothing at all. The key is to weigh these risks carefully against the potential benefits, taking into account the unique circumstances of each patient. Personalization is another cornerstone of Medicine 3.0. In the traditional model of Medicine 2.0, treatments are often based on large-scale clinical trials, which provide averages that may not apply to individual patients. For example, a medication that works well for the average patient in a clinical trial may be ineffective or even harmful to a specific individual whose biology differs from that of the trial participants. Medicine 3.0, by contrast, takes a more personalized approach. It considers the unique genetic, environmental, and lifestyle factors that influence each patient's health and tailors treatments accordingly. This shift from a one-size-fits-all approach to personalized medicine is made possible by advances in technology, such as genetic testing, continuous glucose monitoring, and artificial intelligence, which can analyze vast amounts of data to provide more accurate and individualized care. One of the most significant advances in personalized medicine is the use of continuous glucose monitoring, or CGM, devices. These devices allow for real-time monitoring of blood glucose levels, providing a continuous stream of data that can be used to make more informed decisions about diet, exercise, and medication. Unlike traditional tests, which provide only a snapshot of glucose levels at a single point in time, CGM devices offer a dynamic view of how a patient's glucose levels fluctuate throughout the day. This allows for more precise adjustments to treatment plans and helps patients better understand how their lifestyle choices impact their health. While the technology behind Medicine 3.0 is rapidly advancing, it is not the only factor driving this shift. Equally important is a change in mindset, a shift in how we think about health and disease. Medicine 3.0 places a far greater emphasis on prevention than on treatment. Rather than waiting for diseases to develop and then trying to treat them, Medicine 3.0 aims to identify and address risk factors early, before they can lead to illness. This approach requires a proactive stance, with healthcare providers and patients working together to monitor health indicators and make lifestyle changes that can prevent disease. Prevention, however, is not just about avoiding illness. It's also about maintaining health and quality of life. This is where the concept of healthspan comes into play. Healthspan refers to the period of life during which a person is healthy, active, and free from serious illness or disability. Medicine 2.0 has traditionally focused on extending lifespan, often with little regard for the quality of those extra years. Medicine 3.0, by contrast, emphasizes the importance of healthspan, aiming to help people not only live longer but also live better. Improving healthspan requires a holistic approach that addresses all aspects of health: physical, mental, and emotional. This includes promoting regular exercise, a balanced diet, adequate sleep, and stress management, all of which are crucial for maintaining overall well-being. It also involves monitoring and managing chronic conditions to prevent them from leading to more serious health problems. For example, regular exercise can help maintain muscle mass and bone density, reducing the risk of falls and fractures in older adults. A healthy diet can help prevent obesity, diabetes, and heart disease. And managing stress can reduce the risk of mental health disorders, such as depression and anxiety, which can have a profound impact on overall health. One of the challenges of Medicine 3.0 is that it doesn't fit neatly into the current healthcare system, which is primarily geared toward treating acute illnesses and injuries. Preventive care, while recognized as important, often takes a back seat to more immediate concerns. Insurance reimbursement policies, for example, tend to prioritize treatment over prevention. A doctor may be reimbursed for prescribing medication to treat diabetes, but may receive little or no compensation for spending time with a patient discussing dietary changes that could prevent diabetes in the first place. This misalignment of incentives is a significant barrier to the widespread adoption of Medicine 3.0 principles. However, the potential benefits of Medicine 3.0 are too great to ignore. By focusing on prevention and personalized care, this approach has the potential to reduce the burden of chronic diseases, improve quality of life, and ultimately extend both lifespan and health span. It also has the potential to reduce healthcare costs by preventing expensive treatments and hospitalizations that could have been avoided with earlier intervention. The journey towards Medicine 3.0 is not without its challenges, but the rewards are well worth the effort. To fully realize the potential of this new approach, both healthcare providers and patients must be willing to embrace change. This means adopting new technologies, changing the way we think about health and disease, and being proactive in managing our health. For healthcare providers, this may involve staying up to date with the latest research and technologies, rethinking traditional approaches to treatment, and working more closely with patients to develop personalized care plans. For patients, it means taking an active role in their health, being open to new ideas, and being willing to make lifestyle changes that can improve their health and prevent disease. Medicine 3.0 is not just about treating diseases, it's about empowering people to take control of their health and live their best lives. It's about understanding that health is not just the absence of disease, but a state of complete physical, mental, and social well-being. It's about recognizing that every patient is unique and that one-size-fits-all approaches are often inadequate. And it's about realizing that the best way to treat a disease is often to prevent it from occurring in the first place. As we move forward into the era of Medicine 3.0, the focus will increasingly shift from treating illness to promoting health. This will require a fundamental change in how we approach healthcare, but the potential benefits are enormous. By embracing the principles of Medicine 3.0, prevention, personalization, and proactive risk management, we can help create a future where people live longer, healthier, and more fulfilling lives. This shift will not happen overnight, and it will require the collaboration of healthcare providers, patients, researchers, and policymakers. But the journey toward Medicine 3.0 has already begun, and with continued effort and innovation, we can make this vision a reality. The future of healthcare is not just about treating diseases. It's about empowering individuals to take control of their health, prevent illness, and live their best lives. Medicine 3.0 is the path forward, and it offers a new way of thinking about health and healthcare, one that is focused on prevention, personalization, and the long-term well-being of each individual.